Hi YouTube, it's Laura from Waited So Long. I haven't been around the last couple of weeks, it's been kind of crazy, so I've got a little bit to catch you up on. Ignore the mess in my background because I've been packing up boxes to send my old clothes that don't fit me anymore on to people who need them. And yeah, so it's kind of a mess. Anyway, let's see. So I didn't post last week or the week before, and I'm a day late to post this week's, so I've got a little bit to catch you up on. So basically on September 4th, that was 2 weeks ago, the last time I made a video, I was 197.2 pounds. On the 4th, which was a week later, I was 197.2 pounds, which sucked butt. Then a week later, I had dropped 2 pounds, 195.6. And yesterday I stepped on the scale and I weighed 190 pounds, 0.6. How I did that, I don't know. I don't know what I did. I wish I knew what I did because then I would do it again and again and again. Because 5 pounds is like unheard of for me. I usually use 1 or 2 and I'm happy. 3, I'm ecstatic. But 5 is crazy. Anyway, so what's been going on? I've been having these pains in my stomach. It's like if your sternum, at the bottom of your sternum is sort of where your pouch is. And sometimes when I eat, I have this pain. It's on the right side, and it kind of radiates through to my back. It usually happens sometime after I eat. It could be an hour or 2 later. It could be right away. It's hard to say. I've been trying to pinpoint what it is that causes it, but I don't know. And then I started noticing that I was having white or very light colored poop, which is not really a good sign. I know that that's a sign of like liver failure, or not failure, but maybe your liver's not working properly. So I brought it up to my doctor, and he of course right away was like feeling around. He stuck his finger up underneath my rib and had me breathe, and it really hurt. And it's right where your gallbladder is. He goes, oh yeah, you tested positive for, what did he call it? Murphy's. And he goes, yeah, that almost certainly means your gallbladder is going to have to come out. I was like, oh. So he sent me for an ultrasound and gave me a referral to the surgeon who did my bariatric weight loss surgery, because I can get him to take my gallbladder out as well. So Dr. Yedigar, my surgeon, he contacted me and was like, what's going on? So, I told him, and I said, I'm going for an ultrasound that the other doctor has asked for. He goes, okay, after it's done, I'll send for the results, and then we'll get back with you. So, had the ultrasound done, doctor's office calls me, no gallstones. And I'm like, well, why am I still having pain then? Why is my poop light colored? This isn't good. So, yesterday they sent me for an MRI, and which was kind of creepy. You see it all the time on the TV where these people are like on this little narrow table and then they slide them into this machine. It's like, oh, if you are claustrophobic, that is not the place for you. I opened my eyes and like the machine was like this far from my nose. I was just like, oh God. So, but I did fine. It was okay. It was one of those things where they tell you, hold your breath. And you keep holding it until the machine stops making all its noise. And then he says, breathe. So, I'm waiting for the results on that. And what else? Went to Las Vegas a couple weekends ago with a friend. It wasn't any big deal, but yet another reason why I've been busy. And if you can hear the whining, that's my dog, Rowdy, because he wants to come in and be with his mommy. And I've got the door shut. I don't know what else to say. I'm starting to be able to fit into size large shirts, and I went into Express last night. The last time I was in an Express, it was like 1986 or 87, and it was like this really cool store. And I remembered that it was the kind of place that they don't really have any big sizes. So I walked in there last night because I saw they were having a 60% off sale, and I was like looking around, waiting for the salespeople to give me the stink eye, like, what are you doing in here? Because your kind can't buy anything in here. And they didn't. They were nice, and I said, can I try on this shirt? And they're like, oh, sure, come with us. And I was like, I'm welcome in Express. And I got a size large shirt. It's so weird to be able to buy things in the not real stores, the regular stores. yeah. So anyway, it was very exciting for me, I have to say. This weekend I'm going to Magic Mountain for my birthday. Woo! Turning 45. Woo! Well, that's not really so woo, but anyway, whatever. All right, this video is 5 minutes long. It's time for me to go. And excuse my parents. Yeah, I'm kind of looking rough. And by the way, I'm starting to worry. I'm totally going bald. When I pull my hair back in a ponytail, look, I'm totally getting like this bald spot right in here. It's like gross. And when I lean forward, like you can see my scalp. And I'm just like, oh God, I'm getting to that 3-month point, 2 more weeks. And I'll be at the 3-month point from post gastric bypass surgery. And that's when they say the worst of the hair falling out happens, because the health of your hair now reflects your health 3 months ago. That's what my doctor told me. So I'm already almost bald. You can see my scalp. It's thin, thin, thin. And the worst is yet to come. So if you see me wearing a lot of hats in the future, you know why. Anyway, I'm taking biotin, I'm taking Silica Plus. Those are both supposed to help with your hair growing back. And I am using a tea tree oil treatment. You know, like I rub it into my scalp at night and I leave it overnight, the night before I wash my hair. And I just bought a tea tree shampoo from Wen Hair Care, the infomercial on TV. By the way, I love Wen, and they're not paying me to say this. But I do. I love the Wen Hair Care. It's awesome. So, and it lasts a long time, and it makes your hair super soft and healthy. All right, I really gotta go. It's almost 7 minutes. I'll try and see you next week. If I remember to make the video. Bye.